Okay. Hi, everyone. Welcome to our second and final NAF virtual speaker event tonight. I'm Becky. I am one of the NAF co-chairs, and we have Dr. Kara Odom Walker here to talk to us tonight. I'm very lucky to have her. Dr. Walker is Executive Vice President and Chief Population Health Officer of Nemours Children's Health. She leads the Nemours Children's National Office of Policy and Prevention, the Value-Based Services Organization, and related advocacy and public policy, as well as all aspects of population health strategy, research, innovation, and implementation. Prior to joining Nemours Children's Health in 2020, Dr. Walker served as Cabinet Secretary of the Delaware Department of Health and Social Services under Governor John Carney's first elected term from February 2017 through 2020. She was previously the Deputy Chief Science Officer at the Patient-Centered Outcomes Research Institute and is a board-certified family physician. Dr. Walker is a fellow of the American Academy of Family Physicians and an elected member of the National Academy of Medicine. Dr. Walker holds a medical degree from Thomas Jefferson University, a Master of Science in Health Services Research from UCLA, and a Master of Public Health from Johns Hopkins University. And I will turn it over to Dr. Walker.
Thank you so much, Becky. It's such a pleasure to be with everyone tonight and looking forward to this conversation. I am going to somehow pull up my slides. There we go. Thank you. So what I want to spend some time with you is how federal advocacy works. And this is something I do in my day job now and have done over the years. But also a little bit of context on how you can incorporate this not only as a medical student for change, and I'll take a case example of one particular bill that might be of interest, but also how you can continue to incorporate it in your career. And whether you do it day to day, like I have in some of the roles I've had, or whether you engage through national associations, I think that our voice as physicians, as leaders, as members of SNMA, National Medical Association, can be incredibly powerful. So I'm really looking forward to our conversation. But a little bit about me. You heard my bio on paper, but I really have embraced the notion that what I want to do with my career is take all of these skills that I've accumulated and turn them outward to our community, turn them outward towards the organizations that I've positioned myself in, and place others at the center of our decisions. And sometimes that's patients and families. Other times it's really your team and those that you're leading. And in other circumstances, it can be those who are looking outside of your walls of your day-to-day interactions, but looking to you for guidance. And I think that opportunity to influence and impact policymakers is incredibly powerful. I'll share a little bit about why I think this is so important. So what brought me to the role that I have now at Nemours is that I have always wanted to seek ways to improve the world around me. And whether that's through science and technology, or whether that's through finding evidence and deploying it, I've always been grounded in the idea that I wanted to serve minority, underserved, vulnerable populations through my clinical work, through the work that I do every day, and have accumulated tools along the way, whether that's through health policy and public health, research training, or as a family physician. I still see patients, not as much as some of you may, but I think that that grounds me in why I want to do the work that is so critical. This slide is supposed to be animated. Sorry, it didn't work on StreamYard, but just a little bit about me. I'm kind of telling you how old I am on this slide. I was born in Delaware. I'm from Delaware, great state. Happy that Biden is in the role that he's in. It is a small world. And so I do remember him coming to my high school and telling us about his work as a congressman over the years. I was from the state that embraced the 3 C's. Delaware is all about chickens, credit cards, and chemicals, and went into chemical engineering in undergrad. I really found a love for science and medicine through my studies in engineering and decided to apply to medical school kind of late in undergrad. But the idea that we could innovate and learn and lean in through science and engineering was exciting to me, even as a medical student. But I got to Jefferson in Philadelphia. Maybe some of you out there are studying in Philadelphia, and really understood to a greater extent how we could create change through our voices and through the work that we're doing, engaging with community. SNMA was the vehicle for that for me. It was the way that I learned about programs, services, what it meant to create a health fair, what it meant to create a new program. We were standing up a new society around public health infrastructure. I ended up being chapter president, serving on the regional board. And my last 2 years were dedicated to service of SNMA as national president. And I would say that opened my eyes to what it means to use your voice and advocate. And as SNMA national president, we had a very important opportunity to advocate at the time for affirmative action, for bringing together diversity initiatives across professional students, and lean into leadership and what it meant to create a National Leadership Institute. Those opportunities, in my mind, were about elevating above what we just saw in the day-to-day, but really about how we thought about health equity issues more broadly, how we thought about policy and advocacy. And I saw people, mentors, who were doing this work as part of their career, their drive, their passion, and wanted to figure out a way to have a career centered in the same path. I then, after medical school, decided to embrace family medicine. I thought, if I'm going to do this non-traditional career path, I wanted as broad a clinical background as possible. And I think you can do that in a lot of different ways. But for me, it was family medicine. And I really wanted to think cradle to grave about how we created change, how we found programs and investments that made a difference. I did the RWJ, Robert Wood Johnson Clinical Scholars Program, UCLA, and focused my research and my fellowship on how we work with safety net programs, how we work with the community of South Los Angeles to inform recommendations around reopening a large safety net hospital. After my clinical and fellowship training that was centered in community engaged participatory research, I then went on to faculty for a couple of years at UCSF in San Francisco, back to where I did my residency training, and really thought about how do we measure and understand accountable care entities, thinking about how we understand the patient experience of healthcare and create more cohesiveness in a longitudinal way. I then moved back east to be closer to family, and had this amazing opportunity in alignment of the stars where the Affordable Care Act was being implemented and resources were being poured into many different health policy areas. I was very fortunate to be at the ground floor of the Patient-Centered Outcomes Research Institute. I joined at a time when I didn't really have a title. I didn't have an office. I don't think I had a phone for about a month because we were just so new and just figuring it all out. But after 5 years, I had 5 jobs and ended up as Deputy Chief Science Officer, running their $2 billion portfolio around how we create long-term investments to inform better decision-making for patients and other in the healthcare community. PCORI was going through some turmoil at the time, and we were trying to decide whether it would be reauthorized, refunded. And at the time, someone from back home in Delaware called and said, "Hey, any chance you want to come leave DC and come back up the road to Delaware and join Governor Carney's administration?" And, at the time, I wasn't quite sure what that meant. I said, we could talk about it. One thing led to another. I ended up being cabinet secretary of the largest state agency in Delaware, running Medicaid, social services, public health. And as many of you know, during this time, I started in 2017, but at the end of the first 4-year term, COVID hit. And so we had the opportunity to really lean into public health, think about health equity, how we were going to support communities. And it was quite a long and deep opportunity to learn about advocacy and how many voices come together to push for services, programs, and the right thing to do. So after COVID, I was looking for new opportunities and landed with Nemours Children's Health, which is a multi-state children's health system that spans 5 states. has a hospital in Wilmington, Delaware, as well as one in Orlando, Florida. Maybe some of you have visited our hospitals or our clinics, and really honored to lead work out of our DC-based National Office of Policy and Prevention, but also run much of our value strategy. So I think about Medicaid, our policy and advocacy work often, but also what we do at the state level for state legislatures and how we move forward with value-based payment. So that's a little bit about me. And I wanted to just take a step back and say, you probably already heard some of this about how federal lawmaking works, but it's really critical to understand it when you're messaging and lobbying. As you know, the United States Congress is responsible for federal legislation, and they have leaders who represent our states, and they have leaders in the House of Representatives that depend proportionally on how big the state is. For Delaware, we only have one representative. We have two senators, and it's very different in Florida, where I spend a lot of my time. Each chamber has its own committees, rules, leadership, and I will be happy to take any questions about how that works. But I think it's really important when you're advocating at the federal level, there are some authorities that exist only in Congress. Appropriations is a key one, making sure that we actually have provisions and dollars for large safety net programs, Medicare, Medicaid, how we think about Social Security, how we think about supports that flow to the states for educational resources. So we're going to talk through a little bit of that, but I do think that balance is important. When I was at the state level, it was different. We actually needed to make sure that we were not only taking the federal dollars, but then deploying them. So I ran programs that were completely dependent on federal authority and authorization, but the state had flexibility in how they shaped those programs within a few guardrails. But really how we thought about some of the safety net programs, SNAP, for example, WIC, some of these programs that really are essential to our social safety net are flowing through the states with their own ability to kind of steer, supplement dollars, or think about things that they're passionate about. So I think that's critically important. This is, again, the idea that when you are advocating, you have multiple steps in the process to advocate, to push, to shape legislative activities. You could be part of a push that says, this is an idea that should be law. And there might be something that you say, this is the right idea, Congress should pass it, I'm going to write something up. And that might be just a concept paper. It might just be a couple of pages, a couple of key points that someone, a staffer, a chief of staff, a committee member might shape into legislation and figure out where it would fit into statute. It could also be that you're saying, we already see a bill that exists, and this step 2 around bill introduction is critical. You might find a congressional office that says, okay, we're going to take this draft legislation and be the one to introduce it and sign on, be a sponsor. And there are key opportunities to be sponsors that will allow leaders to see how much support a bill has in advance of it moving to the floor, moving to the committee. So I think these are two very, very powerful ways that you may consider thinking about advocacy, and whether it's now or again in the future. I think the other place is that sometimes you can advocate for placement in a particular committee. Sometimes you don't have much room, but there are times when you want it to start in a certain committee because of who's sitting around the table, who may have the most political buy-in and will, which party is in control of the agenda. And so that can also be, that step 3 can also be another really important opportunity. Now, there are also times when, as advocates, you will want to think about changing a bill. There are lots of bad bills that move forward all the time. And so thinking about step 4 around markup is another place where you can either shift language, you can ask for a rewrite, you can ask for additional language to be inserted or included. This is something that my team pays attention to very, very closely. Government affairs teams who are very good at saying, the concept of this bill might be great, but we actually really need it to say something totally different. So you add in language, and people will add all kinds of things that will either make a bill move forward and be successful or make a bill die. And that, I think, is an art as well of advocacy. I'm going to skip ahead to moving things through to the floor. I think that is going to be a challenge in this congressional session, I will just say, as a whole, because it does take alignment between leadership and what will move forward on an agenda. But you can also imagine that if something was resonating and had the votes to move forward, it might go forward. It may even get passed by either the Senate or the House. After passage by the chambers, you can see sometimes they will conference if there are two versions of the bill that don't exactly match. They need to come together and merge the ideas together, and then they'll have a final vote and it'll move forward to the president for signing as law. So that is just a bit of context. Again, probably something everybody that's listening in knows, but I do think that advocating on the Hill is incredibly powerful and important. It is the way that many bills get moved forward, and you often have a chance to educate policymakers on issues that are relevant. So advocacy can drive both the change that we all seek at times, but I think that the voice of medical students is particularly valuable. For one, there are lots of people who advocate on the Hill who are paid to do so. They are paid lobbyists. They are very savvy. They host dinners and receptions, and they have a polish to them. But I think is so special about medical students in particular coming together is that you can share your unvarnished experience with patient populations. It is coming as, you are a student doctor and you should speak with that confidence and expertise. And you can bring a very important, unique, and personal story. Oftentimes, it's just data. It's just some words. They sound very wonky on a page. But if you can make it real for decision makers around why this matters, around who will be impacted, about how potentially your career or your practice or your future aspirations would be changed, I think that is another very important reason why to advocate. And I will say, again, I know we're focused on the Hill, but when I was Secretary of Health, some of the most important phone calls or letters that I got were from people who are mostly doing their day to day, and they would send me something about why it mattered. Now, I always read those letters, those emails, I took those phone calls because they were really helpful to understand where to prioritize certain initiatives out of everything that was coming to my desk. And that is, again, a very special moment. If a physician called me, I always answered. If a student called me, I always wanted to hear what they had to say, because it just comes across as very different. And sometimes it wouldn't be worded exactly in the way legislation would need to be written or a budget bill needed to be passed, but I had a team that could help support where things would go, where decisions needed to go. So sometimes just hearing where those problems are and where they exist was incredibly valuable. So I would encourage you to think about that. Think about the stories, think about the impact, think about how to make it real. So if you are speaking to legislators, you do want to be a little bit prepared. You want to be prepared with your story, but you also want to be prepared with your ask. The more impactful you can be, often it's you're not there alone. Maybe you're meeting with a legislator that is connected to either where you are from, where you are studying, where you studied before, where you've lived. There's some connection to who you are and why you're meeting with this particular office. I think that can be helpful. Making that connection through their bio or some personal anecdote can be very helpful. And knowing their priorities. I mean, if they're going to say no from the get-go, it's not worth raising a particular issue in an advocacy meeting. So I know the team is researching some of these issues in particular, but it would be great to make sure you have that alignment, and also to say, I know where this issue is, either in committee, on the floor, in draft, and be able to highlight that as well. So you usually want to have kind of your soundbite as well as your ask. It's also incredibly valuable to be able to describe how a policy or potential policy affects their constituents. For example, one of the things that Nemours Children's Health is advocating for is for GME dollars for children's hospitals. It's different from the adult world of training dollars, and we're always educating our members of Congress about how these dollars impact the state. How many doctors would be trained to serve their communities if these dollars were different? And I think that's just one example of how I think making it relevant, making it local can be very valuable in these conversations. I will say this next bullet is also really important. You do want some data, so you want to balance your story with some data, but don't overdo it. And I will say, if I had to write my talking points myself, I'd probably always overdo it because there's so much great data out there and there's so much to say. But legislators and their staff really don't want to hear it generally. So keep it short, keep it brief, keep it to 2 to 3 key points. And you can always follow up later if they're really interested in an email later or a follow-up reference that they think would be helpful. I definitely think weight your conversation more towards the experiences, more towards your stories, a few data points, and then your ask. And I think that will really help bring the advocacy that you're pushing for to light. So what to expect? There's lots of work that can happen in advance of these meetings, but don't expect the meeting to go very long. Often they last 15 to 20 minutes. That's pretty normal. Sometimes they can be less. They can be 5 minutes in a hallway conversation because they realize that the time they picked was kind of off. And sometimes they may pop in, they may have the staff with you for the full 20 minutes, and the representative or senator, the member of Congress, will just pop in and say hello, and then they leave. And they may only be there for the chit chat and leave their staff to actually hear the content, hear the data points, and hear the ask. So expect that. It's very normal. It often happens. We are often rescheduling meetings with members because a vote pops up or something changes in an agenda or they're leading a different conversation. They often will not commit on the spot either. So expect a kind of neutral reaction. I'm going to take that back and look at it. I'm going to understand a little bit more. I'm going to have my staffer research this issue. And if they ask you questions, it's definitely always okay to say, I don't really know, and I'll follow up later with you, or I'll send you something later. Totally fine. You will absolutely know when this meeting is over. They will not mince words. It'll be, thank you. We'll take a look at it. I'll take that to my boss, who again may or may not have shown up and waved at you. But I think in a lot of ways, they really enjoy meeting people, especially if you're in person. They do enjoy meeting people who are have a local connection to where they're from. So that can be incredibly valuable. So again, general advice. Be there on time, even though they may need to reschedule, reshuffle. Be polite, professional, friendly, all these things, Be concise and to the point. That prep is really important. And let them ask their questions. And they may ask questions that are completely in line with what you're talking about. They may ask completely different questions because they're working on some other bill that they think you might have an opinion about, and they may want to pick your brain. If they do say they're only meeting for 15 minutes, know that is really their limit. And do always ask if there are questions or anything you can follow up with. I think that the most powerful thing often is these stories, the potential impact that it could have, and the unintended consequences that can happen at times when you're advocating for things. So the most powerful thing around our advocacy work is sharing your story, sharing your personal stories, sharing your stories around interacting with patients, with families. And you want to educate and raise awareness around the things you're passionate about. Often it is how the social determinants of health, like food security, relate back to health outcomes. Maybe you have, we know the evidence is there, but I think that's another area. We'll talk a bit about the Momnibus, but this is another really important area to hear the voices of healthcare providers and how we address maternal and child health, how we address Black maternal health, and how we really make sure we're connecting back to the issues and centering on not only moms, but children around our country. And I think this is a place where it really is about the storytelling and the support. It is not a completely Democrat or Republican issue. And so trying to find a way to get bipartisan support is an important opportunity right now. So I thought I'd also highlight some key legislation that's moving right now that you either may choose to advocate for or you may highlight as something that you get asked questions about. So the Black Maternal Health Omnibus Bill is actually a package of 12 bills that would address maternal health in a range of ways. We need it. I don't need to tell all of you why we need it, but 700 mothers die each year from pregnancy related causes. Many are preventable. And unfortunately, we have this growing gap that has not been stemmed by all of the technologies that we have available. Black mothers are 2 to 3 times more likely to die from pregnancy related complications. The key provisions in these 12 bills are making investments in social determinants of health, many through other programs, often through Medicaid. It also helps support the perinatal workforce and invests in telehealth so we can provide care in different care situations across different geographies. We also know we need better data and quality measures, and they need to be tracked through standard ways to understand, measure, report them. Right now, we're anticipating it will be reintroduced. It's a great time to advocate and tweak it, make adjustments, or just say it just needs to be introduced. This is a major issue that we need to invest in and that we need additional resources. Um, there's another bill that's moving forward that's pretty unique. So the Farm Bill authorizes many federal policies that are supporting food and agricultural programs, including the SNAP program, including other important opportunities to support children in schools, as well as the WIC program. So more than 34 million people in the US are food insecure, including 9 million children. And these investments help support the food supply chain. They support health. There are many reports out there right now. It is one of the largest anti-poverty programs that exists, and it currently is a huge investment in how we think about food and nutrition, health, and anti-hunger initiatives. It's only reauthorized once every 10 years. So this window is incredibly important. And with the current congressional makeup, it's really important to advocate for this. We know that SNAP overall accounts for about 75% of the total expenditures. It's a massive program, but there are other initiatives to evaluate what works, to think about new innovative ways to deliver food and to make food more accessible in food deserts. And so this is another really important opportunity for advocacy. I do think that SNAP is one of the most interesting levers that I was really trying to figure out how to connect back to our Medicaid program as Secretary of Health. And it is because it's connected back to anti-poverty. There are fewer barriers to addressing poverty from legislators when you start talking about food. Most people agree people in this country should not be hungry. And for that reason, it has stayed and it has reduced poverty and food insecurity. It also has less stigma than some other anti poverty programs. If you think about welfare and the TANF program, there are less requirements for work that are connected to it and less barriers for those who may have mixed household immigration status. And so it is a critically important program for many, many of our patients and communities. Unfortunately, we also are about to lose some of the additional funding that went into SNAP because of the public health unwinding and because of some of the COVID specific pandemic relief that was connected back to SNAP. So I do worry a lot about what will happen around food insecurity, particularly among children. During COVID, we saw a significant uptick in SNAP benefits. And we also saw that ongoing research is needed to make sure that we're really addressing how families continue to have SNAP benefits for beyond the 6 months. We also know that for pregnancy and for maternal health, SNAP is critically important. It helps improve outcomes for pregnant mothers. It helps improve outcomes among early childhood for birth and for long-term health. And it is a really critical connection back to health. We don't make it easy for people to enroll in both Medicaid, SNAP, and other programs, but I really hope that this version of the Farm Bill will make those connections more clear and will make the data. For example, you would think that those who are eligible for Medicaid would automatically have some access to SNAP benefits without needing to go through a separate process, but that doesn't quite exist. You would also think that all that we know around food, nutrition, obesity, cardiovascular disease, we would make it easier to have well-aligned, low-salt meals that are available for those who want it or incentivized, but we don't really make that easy in many of these federal programs. Some states are trying things out, which I think is really creative and interesting. It is definitely an area that requires more innovation, more research, and more support. So there are some key SNAP provisions. I think this will be mostly focused on benefits and eligibility. We anticipate erosion of who is eligible and who may receive the benefits. We do see many critics saying they're going to limit SNAP eligibility, and because it's such a large budget item, they may try to cut costs pretty bluntly. I think this is going to be a challenge. The Farm Bill is going to be introduced this year. And again, it is a 10-year bill. I think the current legislation, which expires, may go through, an extended deliberation process. But I think this is something to pay attention to and to advocate for. So I said I was going to talk for about 30 minutes. It's about what I had in terms of slides. I really look forward to your comments. Put them in the comment section. Really looking forward to dialogue and any comments, questions, suggestions you may have.
I don't see any questions in the chat yet. Karina, did we have any of the pre-submitted questions?
I see a few popping up. That is super helpful. So I see a question about how do you balance advocacy with work-life balance? Well, you're listening in right now to something that is completely voluntary, but you have engaged and supported the idea that you're going to spend some time learning more. I think advocacy is the same. You decide how much you can do in your professional life and your personal life. I have 2 kiddos. They keep me really busy and had lots of sports games somehow. But I am fortunate that this is something I do, all day long, and I have the whole team supporting advocacy. So sometimes what I need to create that balance is finding ways to have other voices, whether those are other leaders across the enterprise, residents who really want to lift up and testify, are some of my favorite go-tos to make sure that we have that balance, because I do think more and more we're trying to figure out ways to tell these stories that aren't just from me, that aren't just from, this executive in the C-suite, but really around who's seeing patients every day, who has a story about, how we've engaged a community or some other problem that we've been facing. For example, we had a supply chain issue just a few months ago where we were running out of endotracheal tubes. We really needed them. We had to call the FDA. We had to call the congressional offices to try to figure out a way to make sure we had a really critical supply need addressed. And I think that is an example of advocacy. I do think as a student, it's hard. I mean, I think finding the right topic, the right timing, and so I would say lean into those who are doing this full time, either organizations, professional organizations who are lifting up the same issue, where you can create kind of a sign-on letter, where you can do an op-ed together and you can sign on to it, or that testimony is needed and someone can say, hey, this bill is coming up. I know you're passionate about maternal health or child health equity or nutrition. Can you please come and share your perspectives? And I think the biggest challenge is the flexibility, because all of these hearings happen generally during the week. They're, sometimes not at ideal times and a little bit unpredictable. So you have to hold your whole day. And as a student, that meant I needed to ask a lot of people for permission to step away from either rotations or, classes. Sometimes it worked out, sometimes it didn't. And I think that is a challenge. I hope I answered that question. Feel free to send in clarifying things. Having worked closely on legislation, what would you like to see as current and future doctors to get more involved? Oh man, and I'm sorry I stole your job, but I think that we have so much opportunity as physicians to better inform health policy. Most health policy is not written by doctors. It's not written by even people in healthcare. It's written by people who just care passionately about a budget issue or fixing a challenge that exists for them in a community organization. And so it gets steered towards their lens, their particular lens, whatever that is, their disease condition, their particular passion area. So I would love to see, just on a whole, more current and future doctors getting involved. What I see as the biggest challenge is what I was talking about before, is that it's such a unpredictable flow, and there's so many decision points along the way. You really do need someone tracking this every day, or tracking it, on a regular basis, whatever that particular issue is. So I would say the best way to get involved is to stay closely aligned with professional societies, those who do have full-time government affairs, people, but then let them know, I feel passionate about this issue. When you anticipate testimony, when you anticipate needing a letter, I would like to be part of that. And so that is the way I think it can be very useful. And then not being shy about saying, okay, I'll write a letter, and who can I write a letter to? And they'll say, oh, you want to sign your name to this letter to the secretary or to the president or to the governor? And say, yes, I'm willing to. And I always think that is something that is heard in a very different way from those who are paid lobbyists, who are very savvy and very good at their jobs, but it's just a different voice. So in Delaware, we were trying to pass legislation around improving and increasing primary care investments. And I will tell you that even though I'm a primary care physician, my job was in this box of, I'm representing the governor. When 10 doctors came and provided testimony around the failing infrastructure due to poor reimbursement rates for primary care physicians, some of those physicians breaking down in tears, that legislation got passed. And that legislation passed, again, not because of anything I said. It was because the local medical society organized people to show up in their white coats, bring their stethoscopes, and tell stories. And I think that is really where we need more of that. We need more of it around Medicaid, around Medicare, around how we're paying and reimbursing for care, or focusing on prevention, or whatever the issue is that you feel passionate about. We need to do more of that, and we don't have the right infrastructure always to support it. I'm very fortunate to be in a system that has a very strong, robust office that's dedicated to our congressional advocacy. Most health systems and hospitals have teams that are supporting this work too. And sometimes it's just figuring out where they are. So wherever you land, see if you can attach to one of those organizations or departments.
And then we have another question. What has been the most challenging experience you've had in terms of advocacy? And then what has also been the most rewarding?
Great question. Don't Google me right now, but I would say that the most challenging experience in terms of advocacy for me was, again, taking on this amazing opportunity to lead a state agency and write legislation from within and get it to the governor, get it to legislators, and get feedback from many, many advocates. But I would say the most challenging thing that I've encountered is that it's so hard to advocate for things that don't have a organized professional advocacy organization. So we were really trying to advocate on behalf of patients to lower healthcare costs. But getting those voices of patients who are impacted by healthcare costs is really hard, because of the same people who are just trying to keep their job and keep the lights on and put gas in their car. And they're not going to show up to a town hall and tell the governor what to do. They're just not. Those are the people I want to hear from. They are not showing up. And so I think that was really challenging. What made it so challenging is that there were lots of very organized groups who were against it, who did not want me as secretary or the governor to push forward anything around reducing healthcare costs. And had a pretty aggressive campaign to say, no, that's nice, Dr. Walker. We're not doing that. Go over there somewhere. I think that is really challenging. And I think we're going to continue to have this challenge, because whether it was when I was at PCORI or at the state level or what we're doing now, I mean, children don't vote families who are on Medicaid often aren't the ones calling legislators, and it is a big challenge to make sure their voices are represented. I would say that the most rewarding, gosh, there are lots. I mean, we have such a important voice when it comes to advocating for population health and prevention. So probably the most rewarding was, as I mentioned, this idea that we wanted to support primary care investments, and seeing, again, not my technical health policy background infusing into the legislation and language and getting it passed, but it was seeing the pride in the healthcare community that they came together and they advocated successfully, and then having other states come and ask Delaware, ask the same physicians who advocate, what did you say? What did you do? And we've had probably 6 other states reach out to different members, not to me anymore, but to members of the team, to say, how did you get this legislation passed? This is model legislation. It's really exciting. We need to support primary care and prevention. How do you do more of this in the geography that we're in?
Thank you.
Sure.
And then another question, in your terms, how would you envision a more sustainable and efficient healthcare system?
Oh, I think that we have to figure out how to move to a system that pays for health. And we can use all kinds of fancy words. We can call it value-based payment. We can call it population health. We can call it you know alternative payment models. We can call it whatever we want. But we need, in a short period of time, I think that what we've seen in the increase in healthcare costs over time is going to be unsustainable. And unfortunately, what could happen is that we just end up cutting into the healthcare dollar rather than reorienting it towards prevention and wellness. Even when we think about the SNAP benefit that I talked about, we are investing a lot of dollars into nutrition, but we haven't solved hunger in our country. We haven't solved the prevention issue. We haven't redistributed in a effective way. And in order to get to health, I think we're going to have to figure out health equity, social justice, how we redistribute, how we really take care of our communities in a different way. Some days I'm more optimistic than others, but other days I think this is going to be a big challenge that may happen because of a crisis. During COVID, I must say there were many days when I thought, this is the crisis and we're going to figure it out. We're going to figure out that, oh, we need a public health system that works and that has the infrastructure needed and has the data to look at health equities and has the data to go to the communities who most need us. And we did some of that, but it was really hard. It was very, very, very hard. And I must say, I am not sure, if we couldn't figure it out through the COVID pandemic, what it will take. But I do think it's going to take some real focus. And unfortunately, I wish I had a crystal ball and could say what that push will be and what it will come from. But I think it will come from ongoing kind of advocacy, making it real, and making it challenge. I will just share testimony. I'm sure you could find it online, but I testified to one of the Senate health committees around needing investments in social determinants of health. So all of us, I mean, when I was in medical school, sorry, I had to say that at least once. We didn't really talk about social needs in the same way. I mean, I was working in safety net settings. I was working in FQHCs, but we didn't really talk about how to navigate those social needs. We had a social worker. We had people who knew community assets. But I think that the combination of having our cell phones with us at all times and having the opportunity to connect in to other data systems, to me, feels like a problem we need to fix, so that we really can create an ecosystem that says, I'm not just fixing this patient in front of me, but I'm connecting them to real-time resources around housing, around food, around transportation that make it real. Now, when I was testifying, I had a question from a member that said something like, aren't you trying to just create a social care system? And I said, no, like we need to promote health and we need to do this because it will make everyone healthier. And we will actually have lower costs if we figure out how to do this from a prevention angle. So, why wouldn't we start then? I'm sure I'm paraphrasing now, but and said it very diplomatically, very C-SPAN like. But I do think that is a big challenge that we're going to have to figure out. Where do we make these investments? How do we create a system that has equity at its core? And how do we create kind of the data and the connections and the technology needs to help us get there? We also need some really smart lawyers. So if there's any lawyers listening in, we need you to make sure you can connect HIPAA and FERPA and all these laws that make it really hard to do that work.
Perfect. And then I think our next question is, in your opinion, how would you envision a more sustainable and efficient healthcare system? How much are capitalism and racial injustices truly integrated into the system?
So I tried to answer the first one, not sure how I did, but I think capitalism and I'll take them separately. So capitalism is absolutely embedded in the way we currently provide care. In this fee-for-service world, there is so much about how our economics are oriented that's not about the greater good. It's about, just how we provide margin and how we provide access to a whole ecosystem, whether that's the pharmaceutical industry, whether it's how we pay for new technologies. And we're all interdependent, and which is really why I think it's going to be hard for us to change without some major shift in policy and politics. Racial injustice, look, many of you could tell me how it is embedded. It's embedded in why we don't have enough diversity in our medical schools. It's embedded in why we don't have the same representation in our nursing workforce. It's about the things I deal with every day as a Black female executive leader, and I look around and it's not a whole bunch of common backgrounds around the table. So we know that our patients and our families are dealing with racial injustice every day. And we have these long-standing challenges around lack of investment in not only health, but also our communities by zip code, by housing regulations, by educational attainment, by income inequality. And we have a lot to do. I mean, I think part of my role at Nemours is around this portfolio of diversity, equity, inclusion. And we say, there's no health without health equity, because you need those same tools around quality improvement to embed and overcome health inequities to get to health. We also say there's no health equity without diversity, equity, inclusion of our workforce. And there are so many layers of racial injustice that happen just in our day-to-day interactions with people, because we are in an ecosystem of people. I'm not going to change hearts and minds every day. I try, but that's real work. And I think that is really where we have work to do around structural racism, that they are completely ingrained and integrated into all the systems, whether they are, in healthcare or they are outside. Our work is to push where we can through transparency, through reporting, through accountability, and through leadership. So, your voices are important. Making sure that you're at the table to shape and create a better environment are critical for us to be successful. But it's a lot of work to do, for sure.
Okay, and then are there any legislations that can hinder physicians but benefit patients? Is there a way to help both patients and physicians?
I do think there's a way to help both patients and physicians in that. And to me, that's the space of allowing physicians to provide the best care that we are trained to provide in an environment that allows us to thrive and be supportive. There's a lot of work right now around burnout. And I think that this space around well-being and thriving is really critical. And I hope that the connection back to value makes it easier for us to focus on why we went into medicine in the first place. It shouldn't be harder to provide high quality care that embeds health equity But I do think we need to find that intersection. There are definitely a lot of legislative initiatives that can benefit patients but hinder physicians. And it depends on how you're thinking about physicians. I mean, we have things like prior authorization. Um, there's just like bureaucratic challenges that often are put in place to benefit patients out of pocket costs, or make sure they're having kind of tiered therapies. And the idea is to benefit patients, but oftentimes it makes for a lot of work and frustration for physicians. Sometimes it makes it harder to practice. I think there's a lot of legislation around medical malpractice that is originally intended to support patients, but unfortunately has gone a little bit far and makes us, practice differently, and practice in ways that aren't really benefiting patients, and making it really much more around kind of medical legal risk. So those are just a couple of examples. There are lots of examples because, again, the community at large is very good at lobbying. There are interest groups that lobby for particular populations or needs or supports. A lot of the kind of physician and healthcare lobbying is often around the business model, not always, but sometimes. And I think there's sometimes the voice of practices gets lost if you're not part of a bigger system. And so really trying to find ways to find shared goals is important. It's not often part of the political process.
Okay, and I think this is our last question as of now. I think you touched on this a little bit, but could you just go into more detail on how you're able to practice medicine versus like your legislative work, and kind of how you find that balance?
Sure. So um, I will say I've never practiced since fellowship more than a day a week. So I am definitely an oddball when we think about like how my day is structured, and I recognize that. I've always tried to practice at least a half day a week. Now, as Chief Population Health Officer, I mostly practice one evening a week ish, and it's just different. But what I really love is working with teams and uh, leading an organization. So I've done that whether I was at PCORI, the Patient Centered Outcomes Institute, where I was kind of leading the science department and running kind of the internal operations, or whether it was when I was leading, the department of health and social services, and I had 4,000 employees, including a psychiatric hospital and other facilities that I had to lead and support. And so it's different work. But I do think if you go in the route of not necessarily practicing all the time, but doing more of a health policy, health administration role, it's helpful to stay grounded, to see patients a bit. Now, if you're on the other end where you're mostly a clinician, you're mostly seeing patients, I think that the way to carve out space for advocacy is through either key leadership roles, your local specialty society, through NMA, through other organizations, because it is very hard to keep track of what is moving, what's creating impact, and what is shifting, and where your voice can matter most. So I would recommend, if this is something that you're passionate about and staying connected to, but you're, mostly busy, 40, 50, 60 hours a week, it's helpful to have somebody flagging things, whether that's a letter to sign on to, doing a letter campaign, making a phone call when it matters because something's coming up for a vote or something needs legislative action. I think that those are moments that are meaningful, but I would not assume you can track it along all of the other things on your plate, along with like managing work-life balance, and again, like driving what I do on my second job, which is not really a second job, but it's driving my kids around to all their activities. I think you have to find a way to make it worth the time. And just reading the headlines is not going to necessarily give you what the information you need. So there are lots of organizations who have action alerts, who, if you're a member, you sign up for their updates, and they can be very valuable. They will tell you, like, we need you to sign on, or we need you to show up here, or we need you to make a phone call to your legislator. And the more local you can make that outreach, the better. So, if it is about federal action, calling your congressional offices, sending an email, and they make it really easy now. You can do emails, you can do virtual visits. You don't even have to travel. You can just say, I'd love to, set up a video call and tell you about this. I think those can be incredibly valuable ways to leverage your time, your limited and precious time. And again, because these calls often are short, brief, and unpredictable, I think really thinking about other ways to share your support or advocacy is important. So yeah, I totally agree that it is more similar to people who are doing research. I've also seen a lot of people who are very engaged in advocacy think about their specialty choice differently, and so there are definitely a few peers who, like me, wanted to go in this different route and ended up doing emergency medicine, which gave them more flexibility, or did lean more heavily onto the research side. And then they do research on top of kind of having research that informs policy going forward. So I think there are lots of ways to orient your career. I'd be happy to talk more about that if that would be useful.
Thank you so much, Dr. Walker. I think that's everything we have tonight. Do you mind sharing your email again
Oh, sure.
in the chat? Thank you.
In the comments?
Yeah, or I don't think we can from this end.
Well, it's pretty easy. It's Kara, Kara, .walker at Nemours, NEMOURS.org. And happy to talk.
Thank you.
Thank you so much. Wishing you luck, everyone.